Hello everyone, Trump here. Now we are going to listen to podcast news which includes important editorials. While walking in the morning or evening, while cooking, cycling or during free time you can listen. It will enhance your learning and understanding of various accents and pronunciations. Listening improves the quality of communication and comprehension. Before going ahead, I would like to welcome you all to the virtual school. A new way of learning and teaching, with the vision of Let's Grow Together. Our mission is to learn how to learn and teach how to teach. So stay tuned. And here we go. Editorial 1. Rewind to fast forward. Delayed reset on retrospective tax is only the first step to regaining investor confidence. A tortuous taxation tale that began with global telecom major Vodafone's $11 billion entry into India, is nearing its climax 14 years on, with the company having frozen fresh investments for a few years and its Indian operations now on the brink of collapse. On Thursday, Finance Minister Nirmala Sitharaman introduced tax law changes to scrap the retrospective provisions brought in by the late Pranab Mukherjee in the Union Budget 2012-13. IT demands have been made in 17 cases, including from Vodafone and Cairn, using those retroactive clauses in the IT law. That this government took so long to undo Mr. Mukherjee's gambit after losing a tax pursuit against Vodafone is disappointing. Even before 2014, the BJP had called the retrospective provisions tax terrorism. Yet, it did not walk the talk despite a resounding parliamentary majority, while promising global investors that it does not approve of such measures. Whether this was a result of political dithering, bureaucratic bungling or ill-informed legal advice, the sore point for potential investors remained on the statute. This should now lead to a formal burial of a matter that has cost India dear. In Cairn's case, the tax department began action in January 2014, but the assessment orders were passed, and its shares sold off to recover retrospective tax dues under this regime's watch, pending international arbitration. By December 2020, the Vodafone and Cairn arbitration cases had been lost and investors hoped the government would abide by the legal process and close this sordid chapter. Instead, appeals were filed, with the government asserting as recently as May that it will vigorously defend its sovereign right to tax and had never agreed to arbitrate a national tax dispute. On Friday, Ms. Sitharaman said the government was waiting for those cases to reach their logical conclusion. Now that they have, the BJP is fulfilling its commitment that it does not believe in retrospective taxation. If that were indeed the case, the government could have introduced these changes in the budget instead of wasting more legal resources on filing appeals. It is quite clear the U-turn has been prompted by Cairn Energy's relentless pursuit to enforce the arbitration award. That it has sought to get Air India labeled as the government's alter ego, creating fresh doubts for the airline's potential buyers, and a French court has permitted it to freeze Indian assets in Paris, must be significant triggers. Whether Cairn will back down from those claims or forfeit the interest and damages, as offered by the government to close the chapter, will likely depend on its institutional shareholders. Irrespective of the outcome, global capital is unlikely to immediately forget the ad hoc approach to this critical policy issue and rush in. Be it fluctuating trade tariffs or shifting GST rates and rules, India needs to demonstrate greater clarity and consistency in policy across the board to fix its broken credibility. Thank you. Editorial 2. It's hockey as the men's and the women's teams excel at the Olympics. Hockey is again looking ahead. A splendid fortnight in Tokyo has steered Indian hockey back to the limelight tinged with an Olympic halo. Before this, for years the sport, much akin to the West Indies in cricket, had only the good old days cliché to fall back upon. Champions of the distant past but plagued by middling results, was the standard template. There was the odd flicker and the nostalgically inclined with their fond remembrance of legends such as Dhyan Chand, Mohammad Shahid and Dhanraj Pillai, would hope for a sunrise. It often proved to be a mirage while cricket, football, tennis, and Formula One lured the fans. That India had to wait for 41 years for its next Olympic hockey medal tells a long tale of diminishing hope. Thankfully an upward graph has been finally etched due to the grit and skill sets of Manpreet Singh's men, who despite an early 1-7 loss to Australia held their own and winged into the semi-finals where they ran into eventual champion Belgium. The soul-numbing defeat was quickly cast aside and India prospered to wrest the bronze with a 5-4 triumph against Germany during Thursday's third-place playoff. Mentored by coach Graham Reid, India had turned a corner and hockey was the flavor of the season. The ancient game which melded magical wrists, sprinting feet, sticks and a speeding ball, has seemingly reclaimed its Indian heart. If men as diverse as Manpreet and goalkeeper P.R. Sreej showed that India was at home in modern hockey, their female counterparts showed they are equal to the very best. Rani Rampal's unit had a dream run, but a bronze was missed by a whisker. It is one of the greatest fourth-place results in Indian sporting history, and on a par with where Milkha Singh and PT Usha finished in their respective 400m and 400-meter hurdles finals during the 1960 Rome and 1984 Los Angeles Games. If the men revived an old romance with hockey, the women stole hearts with a riveting performance. A semi-final berth followed by a 3-4 loss to Great Britain during Friday's third-place playoff left the nation with a lump in its throat as the women gave it their all on the ground. Rani, goalkeeper Savita Punaya, Salima Tet, and other stars showed that India has its heroes on either side of the gender divide. To battle past stereotypes, misogyny, poverty and casteist boundaries, demands a bigger heart. The women's hockey team had it in abundance, and credit is also due to coach Shuard Marijan, who ended his tenure on a high. The effort put in by Sai and the sponsorship from the Odisha government played a big part too. Indian hockey has found its feet, and this is a redemption song of the finest kind. Thank you. Editorial 3. India's school children need their childhood back. The country needs to stop asking whether schools are safe and start acknowledging that in-person school is essential. Getty Images/iStock photo. The economy is open. Malls, bars, restaurants, and some offices are open, but schools have been closed for 16 months and counting. They have sporadically opened for the higher grade students, and the board examinations have been a key discussion point. There is indeed some basis to the old joke that Indian parents have a razor-sharp focus on academics and want their children to be a doctor or an engineer. This focus is not entirely misplaced, for academic results in the higher grades are important to determine colleges and professions, and for many Indians, a chance at a better life. The wide-ranging impact. However, let us not forget our youngest children. 6-year-olds who have spent more time outside the classroom than inside. 5-year-olds who have never been inside school nor ever met their teachers or classmates. Let us not lose sight of the importance of education in the younger years, as well as the overall purpose of education. In-person school education teaches children to share, wait for their turn, negotiate, and compromise. By depriving them of social contact, we are depriving them of essential learning and development. For children from economically weak backgrounds, schools are a key source of nutrition. For some, schools serve as safe spaces from the chaos of their homes. For many children, particularly those who do not have educated parents or cannot afford home tutors, the denial of education results in learning losses and, ultimately, denial of a chance to earn a livelihood. For parents, school closures have added to childcare and teaching duties. Household incomes are reducing amidst rising inflation as parents, mainly mothers, have quit their jobs. The Indian Council of Medical Research, ICMR, recently stated that once India starts considering, it will be wise to open primary schools first and then secondary schools. Also, we have to ensure that all support staff, whether it be school bus drivers, teachers, and other staff in the school, need to be vaccinated. https://bit.ly/3oqx7t. Researchers do agree, however, that children are at low risk of developing severe COVID-19 compared to adults. Expert opinion. In June 2021, commenting on the World Health Organization All India Institute of Medical Sciences, AIIMS, Sero survey, AIIMS director, Dr. Randeep Gularia said, this study also looked at sero surveillance among children. In the less than 18 years of age group, it was found that more than 50% of children, and in some areas, more than 80% of children from both urban and rural areas had antibodies. This means they were already infected and developed antibodies. The ICMR recently released results of the 4th National Seroprevalence Survey, which showed that more than half of the children, 6 to 17 years, were seropositive, and seroprevalence was similar in rural and urban areas. Given the above, it is possible to think about starting schools in areas where the community level of infection is low. A one-size-fits-all approach across India will not work. This means that in some states such as Kerala or Maharashtra, where COVID-19 cases could be surging again, students should stay home, while their counterparts in other states where positivity rates are lower, can start going to school. There are a host of recommendations on how to open schools safely, including by the World Bank, SRCC Children's Hospital, Mumbai, and the Lancet COVID-19 Commission India Task Force, https://bit.ly/3707xl. Schools cannot be opened overnight. There is a large amount of preparation required, and the longer we wait to begin planning, the longer it will take to implement. As immediate measures, governments should call for lists of school staff and procure full vaccination for them. Scientists should confirm if the gap between doses can be made shorter, akin to healthcare workers, engage relevant experts to undertake public campaigns to make school staff and parents aware of the low risk of transmission in schools and low severity in children, urge them to understand the science and encourage them to commit to a social contract to be ever vigilant and keep a sick or exposed child home, issue guidance for staggered reopening of primary schools, example 50% attendance or smaller groups of students on alternate days or weeks, upgrade school infrastructure to facilitate a hybrid system of learning where parents who do not wish to send their children to school have the choice to continue with online learning, train school teachers in hybrid learning, formulate and issue guidance on COVID-19 protocols to be adopted by schools, distancing to the extent possible, outdoor classes weather permitting, masking, hand hygiene, and proper ventilation. Scientists have indicated that even the humble pedestal fan can do wonders for ventilation, finalize logistics such as packed meals and transport, and ensure availability of medical consultation so that staff and parents need not scramble for assistance. Other required long-term measures, which will also require funding, time, and effort, include greater investment in healthcare facilities, particularly pediatric facilities, and implementation of systems to track local level of infections. Managing the risks. As parents, we must recognize the costs of isolation and online learning for our young children. We cannot wait for children to get vaccinated because this may take years. According to a media report, Britain has said that it has decided against giving mass COVID-19 vaccinations to all children, and they would only be offered in certain situations such as when young people have underlying health conditions. We cannot expect schools to provide a 100% guarantee that our children will be safe. Nothing is risk-free. Risk must be managed with mitigation strategies. Instead, we must build mutual trust among governments, schools, and citizens. Each of us must implement and adhere to COVID-19 safety protocols recommended by scientists. Each of us must be vigilant and responsible, ensure all adults in our households are fully vaccinated, and ensure children stay home if sick or exposed. Until a greater proportion of the population is vaccinated, we should endeavor to curtail unnecessary travel or exposure, because we know from sero surveys that adults are bringing infections home. Parents groups on social media are abuzz with requests for pods of students and home tutors. Education, like oxygen and medicines during the second novel coronavirus wave, is becoming the responsibility but also a privilege of private citizens. We cannot let status quo continue any longer. We need to stop asking whether schools are safe and start acknowledging that in-person school is essential. Extensive literature based on studies on transmission in schools is clear. Children are not super spreaders, schools are not hotspots or driving viral spread. For young children, even a few hours of interaction per week with their teachers and other children would be an excellent starting point. As Robert Jenkins, Global Director of Education for UNICEF, said, there are many countries in which parents can go out and have a nice steak dinner, but their 7-year-old is not going to school. That's a problem. https://go.nature.com/3rvrznd. We need to come together to fix that problem and give our young children their childhood back. Tarini Mathur, a parent, is a New Delhi-based lawyer. Tanya Agarwal, a parent too, is also a New Delhi-based lawyer. They are alumni of the National Law School of India University, Bengaluru, and Harvard Law School. Thank you. Editorial 4. South Asia's emerging digital transformation. There is evidence that the region's post-pandemic adoption to digital life will shape its future prosperity. Getty Images/iStock photo. COVID-19 has forced South Asia to take a quantum leap in digitalization. The shift to remote work in education has propelled an unprecedented spike in internet penetration, with even smaller nations such as Nepal recording almost an 11% increase in broadband internet users. For a region with threadbare public health infrastructure, the digitization of healthcare services was a watershed moment, providing novel solutions to the public health crises. In India, COVID-19 accelerated the launch of the National Digital Health Mission, enhancing the accessibility and the efficiency of healthcare services by creating a unique health ID for every citizen. The pandemic-induced suspension of bricks-and-mortar businesses spurred South Asia's embrace of e-commerce, boosted by digital payment systems. Bangladesh alone witnessed an increase of 70 to 80% in online sales in 2020, generating $708.46 million in revenues, https://bit.ly/3cpgy79. The yawning divide. As one of the world's poorest regions, a wide digital divide persists in access and affordability between and within the countries of South Asia. Despite having the world's second largest online market, 50% of India's population are without internet, with 59% for Bangladesh and 65% for Pakistan. https://bit.ly/3@juok. With monetary and health assistance schemes distributed online, 51% of South Asian women were excluded from social protection measures during the pandemic. https://bit.ly/3xoe7ml. Children too were at the receiving end, with 88% lacking access to internet-powered homeschooling. https://uni.cf/2tin5cp. This disruption could permanently put children out of school, place girls at risk of early marriage, and push poor children into child labor, costing economies billions of dollars in future earnings. Businesses too have paid a heavy price for the gap in digital solutions, whereby many South Asian firms failing to embrace e-commerce or other cloud-based technologies to survive the financial chaos of the novel coronavirus pandemic. The region recorded a 64% decline in sales, with small and women-led firms faring the worst. https://bit.ly/3le2hbr. With COVID-19 transforming work life, the acute skills gap among youth will continue, creating unemployment. Digital inevitability, dividend. Digital transformation is a global imperative, with adoption of advanced technologies such as cloud computing, artificial intelligence, the Internet of Things, big data, etc., key to success. From banking to manufacturing and retails, the role of digital technology is too important to be overlooked as countries embrace the digital revolution to drive their development agenda. At the forefront of Asian digitalization are countries such as Singapore, Japan, and South Korea, recognized as global technological hubs. Owing to increased smartphone and internet penetration, coupled with the availability of trusted digital payment platforms, China's e-commerce industry is said to reach $3 trillion in 2024. https://bit.ly/37gtjw. The digital boom in the Association of Southeast Asian Nations, ASEAN, economies is pushing a common market initiative, fostering regional economic integration and enhancing global competitiveness. South Asia has also made significant strides in the adoption of digital technologies. The Digital Bangladesh Vision 2021 envisages transforming Bangladesh into a prosperous, digital society, whereas India's biometric identification systems intend to improve the efficiency of welfare programs through digital innovation. However, the region still has a long way to go. E-commerce could drive the post-pandemic growth in South Asia, providing new business opportunities and access to larger markets. In India, e-commerce could create 1 million jobs by 2030 and be worth $200 billion by 2026. Fintech could drive significant growth and reduce poverty by building financial inclusion. For instance, Pakistan's digital financial sector could boost GDP by 7%, if faster payment gateway, lower costs, and fast-track licensing are put in place. A timely, inclusive, and sustainable digital transformation can not only bolster productivity and growth but also serve as a panacea for some of the region's socio-economic divides. A checklist for change. To reap the dividends of digital transformation, South Asia needs to address legal, regulatory, and policy gaps as well as boost digital skills. A robust digital infrastructure is a sine qua non, and there exists a huge financing gap. India alone needs an annual investment of $35 billion to be in the top 5 global digital economy, and public-private partnership needs to be leveraged for the region's digital infrastructure financing. Regulatory roadblocks need to be addressed as e-commerce regulations are weak in South Asia. For the sector to drive growth, issues such as customer protection, digital and market access regulation, etc. need to be addressed. There would be no digital revolution without universal digital literacy. Governments and businesses need to come together to revamp the education system to meet the demand for digital skills in online platforms. The cross-flow of data and personal information calls for stringent cybersecurity measures, as many have experienced painful lessons in data privacy during the pandemic. In South Asia, only a third of the inter-regional trade potential has been exploited, losing out on $23 billion in revenues. https://bit.ly/370gir. By addressing issues such as regulatory barriers on currency flows inhibiting online payment to transport-related constraints for cross-border e-commerce activities, South Asia can emulate the European Union's digital single market proposal. During the pandemic, South Asian nations joined hands to collectively battle the crises by contributing towards a COVID-19 emergency fund, exchanging data and information on health surveillance, sharing research findings, and developing an online learning platform for health workers. If the 8 nations, Afghanistan, Bangladesh, Bhutan, India, Nepal, Maldives, Pakistan, and Sri Lanka, can start walking the talk, partnership for a successful digital revolution is plausible. It will need vision, wisdom, and commitment at the highest level of the region's political leadership. Collaboration needed. COVID-19 has rendered old ways of operating redundant. Concerted collaboration at all levels is needed to push South Asia out of stagnancy and towards a digital future of shared prosperity. The right concoction of regulatory and physical infrastructure, skill sets, and regional cooperation can lead toward a digital utopia, whereas the lack of which can breed a dystopian tomorrow. Adequate support is needed for those who risk falling through the net of digital progress. A shared, digital vision could place the region on the right track towards the fourth industrial revolution. Syed Munir Kasru is chairman of the international think tank, the Institute for Policy, Advocacy, and Governance, IPAG. Thank you. Editorial 5. The complex story of rising cases in Kerala Malappuram, the most densely populated district of Kerala, epitomizes the challenges the state faces in controlling the rising number of COVID-19 infections. Abdul Latif Naha and C. Maya explain how the state, which seemed to have a grip on the pandemic, has been faltering. An emergency medical technician helps an ambulance driver take out a COVID-19 patient from an ambulance at Government Medical College, Manjeri. Below health staff attend to a patient in a COVID-19 ICU ward at Manjeri. Sakir Hussain. 2 people have died. Please come and pack the bodies, a nurse tells the cleaning staff who are on a break. Within a few minutes, cleaning assistants Asokan M and Dilip Kumar and a few others begin to prepare the bodies. It is August 3rd and 2 elderly men have succumbed to COVID-19 at the Government Medical College Hospital in Manjeri. The relatives of the dead request the staff to dress the bodies in new clothes one last time. The hospital staff, witness to 4-5 deaths every day on average since April, are used to the routine. They clean the bodies and pack them in specially designated body bags. The Manjeri Medical College is the biggest referral hospital for COVID-19 in Malappuram, the most densely populated district in Kerala, 1,265 persons per square kilometer. It has 344 beds dedicated to COVID-19 cases and 203 beds dedicated to non-COVID-19 cases. The second wave may be on the wane in most places in India, but here things are hectic. The hospital staff are under great pressure. No one here contests the fact that the medical college hospital, which admits only C-category patients, those whose recovery is impossible without proper medical intervention, is not adequately equipped to treat the many patients coming from a district of 48 lakh people. Malappuram is currently the worst-hit district in the state, reporting the maximum number of daily new cases, 3,645 new cases on August 5th. While many are wondering why Kerala, which seemed to have a grip of the pandemic at one point, seems to be floundering now, Malappuram is often cited as a case in point. Chinks in Kerala's armor. Until a while ago, Kerala seemed like it had an exceptional pandemic story to narrate to the world, but today, the chinks in its armor are beginning to show. The state has seen a steady rise in cases since the second week of July. Over the past 8 days, Kerala has recorded 20,000 to 22,000 new cases daily. Between July 29th and August 4th, it recorded nearly 1.45 lakh new cases and 754 deaths and accounted for 43% of the nation's active case pool. Following the first wave, Kerala's epidemic curve plateaued out but never hit the baseline as rallies were held before the assembly elections and people gathered in large numbers everywhere. In January-February this year, it reported 1,500 to 3,000 cases daily, accounting for 45%-50% of India's active case load. Then the Delta variant struck. By the second week of April, when the second wave was ferociously sweeping across the nation, cases began to go up in Kerala. By mid-May, the state was in the grip of a crisis, reporting over 42,000 to 44,000 cases daily. When a total 15-day lockdown was imposed, the case graph again hit a plateau and 10,000 to 15,000 new cases were reported daily. This, however, was in stark contrast to other states where new cases and hospitalizations began to slide rapidly. Public health experts in the state say that the second wave began a month later in Kerala than the rest of the country. Kerala's strategy, they say, has been to spread out the curve, keep a tight hold on disease transmission, and restrict activities, so that the virus doesn't go on a rampage and overwhelm the health system. The strategy worked well because even at the peak of the second wave, intensive care unit, ICU, occupancy in the state was just 67%. However, Kerala is now being forced to take a relook at its containment strategies and the socio-economic aspects of the pandemic, which are threatening to overshadow its successes. It is also being compelled to re-examine the quality of care delivered. While it encouraged home care and isolation for patients who had mild COVID-19, it is doubtful whether the health workers were properly trained to diligently follow up with the patients because the ill began to reach hospitals at a later stage of the disease after hypoxia had set in and many could not be saved. High pressure, few precautions. One COVID-19 patient reached the Manjeri Medical College every 10 to 15 minutes on August 2nd. Most of them were in the age group of 50 to 70 years. All of them had been referred to the medical college by other COVID-19 hospitals in the district through the COVID-19 war room. Although there are 5,093 beds earmarked for COVID-19 treatment across the district in 7 government hospitals, 69 private hospitals, 12 second-line treatment centers, and 10 first-line treatment centers, the 547 beds at Manjeri Medical College remain crucial in the fight against COVID-19. The signs are ominous, yet people are oblivious to the dangers of COVID-19, says Hari Prasad, an ambulance driver who has brought an 85-year-old woman from the government Taluk Hospital, Tirurangudi, 30 kilometers away from Manjeri. 2 volunteers of a community youth organization come forward to help the woman get on a stretcher. As the stretcher is taken, she gasps for breath in spite of having an oxygen mask on her face. The volunteers wear no protective gear other than 2 masks. Many people walk busily through the hospital veranda taking little precaution against COVID-19. 2 casualty wards, one for COVID-19 patients and the other for non-COVID-19 patients, function side by side. Security guards on duty seem to be able to do little to restrict the movement of patients and those accompanying them. One security guard looks worried. 5 of his co-workers have been infected, they all contracted the virus on the same day. Of the 43 security staff, 10 have been isolated after testing positive for COVID-19. Doctors in the casualty wards face tremendous pressure as patients, mostly from the lower middle class, stream in. We have 56 doctors at the hospital apart from doctors from the medical college. The delay in the arrival of the house surgeons of the 2016 MBBS batch has begun to affect us, says Sheena Lal, deputy superintendent. Lal is in charge of the hospital as Superintendent Kilavolt Nandakumar is in quarantine after testing positive along with the resident medical officer. Lal is, however, confident that the pressure on doctors handling the casualty and COVID-19 wards and ICUs will ease with the arrival of the house surgeons in a couple of weeks. The high patient load compels junior resident Dr. Mohammed Sharif to take the risk of alternating between the 2 casualty wards. He admits that the pressure is so high that precautions often go for a toss in the COVID-19 zone. Sharif says the hospital is facing space constraints and staff shortage. But the hospital has more than tripled the number of ventilators and vastly enhanced its oxygen capacity since it reported its first COVID-19 case on March 16, 2020. The number of non-invasive ventilators, NIVs, has gone up from 21 to 73, including 10 portable and 4 neonatal ventilators. There is central east oxygen supply in all the wards following the setting up of a liquid oxygen plant. An oxygen generator is also ready at the hospital. This was done in recent months, says Lal. Signs of a third wave are clear and present, she says. A poorly performing district. Malappuram breathed easy during the first wave of the pandemic as many patients did not require NIV support. But during the second wave, it fell miserably short of NIVs. Manjeri Medical College witnessed 15 deaths on a single day, May 27, during the peak of the second wave. Nearly 10 were on account of oxygen failure. This happened despite Chief Minister Pinarayi Vijayan's assurance that Kerala had adequate oxygen supply. The government joined hands with philanthropists and enhanced the facilities. Although the hospitals in the district have 162 ventilators today, several of them are not working. According to the Kerala Government Medical Officers Association, KGMOA, the district lacks sufficient health staff and infrastructure. Population-wise, Malappuram is 5 times the size of Wayanad and 4 times the size of Pathanamthitta. When the state has an average of 1 hospital bed for 879 people, the bed ratio in Malappuram is 1:1,643. Malappuram's lone government medical college with 547 beds is spread across 23 acres, while the government medical college in Alappuzha, a district with only half of Malappuram's population, is spread across 145 acres and has more than 1,100 beds. A KGMOA study before the COVID-19 outbreak found that Malappuram was responsible for 1/5 of the state's infant mortality and 1/4 of maternal mortality. Government hospital facility for delivery is available only for 16.64% of pregnant women in Malappuram. Prior to COVID-19, the district had stood behind others in immunization and topped in dengue deaths, lifestyle diseases, and road accidents. The strain posed on the health staff in Malappuram district is much higher than what their counterparts in other districts face. If a junior public health nurse serves 5,000 people in other parts of Kerala, she serves 15,000 people in Malappuram. If there is a public health center, PHC, for every 39,000 people elsewhere in the state, in Malappuram there is one PHC for every 53,500 people. If there is a community health center for every 1.4 lakh people elsewhere in Kerala, in Malappuram there is one for every 2.4 lakh people. Because the general hospital was upgraded to a medical college 8 years ago, Malappuram lost super specialty wings such as cardiology, nephrology, urology, and neurology. It also lost the General Hospital and the Women and Children Hospital. A week ago, a central team led by P. Ravindran from the Ministry of Health and Family Welfare visited the district. Blaming the district officials for the shortcomings, Ravindran's team suggested tighter measures for Malappuram to address the pandemic. District Medical Officer Sakina K says that despite the constraints, they were able to restrict COVID-19 deaths to well below 1%. The number of COVID-19 deaths reported in Malappuram is 1,638. This number against a population of 48 lakh is only 0.03%. In fact, that tells us how hard the medical team in the district fought COVID-19, Sakina says. Measures taken by Sakina and her team, such as traveler surveillance, contact tracing, telemedicine facilities, the triage system at the block level, and prevention of cluster formations won the state's approval in the initial phase of the pandemic. Now the team is setting up 326 additional oxygen beds at 7 government hospitals in the district and strengthening the pediatric wards in anticipation of a third wave. Vaccination on the rise. In spite of the initial reluctance of the people towards COVID-19 vaccines, the district is now witnessing a heavy rush for inoculation. According to health officials, it was the second wave that changed the people's mindset towards vaccines. While 39% of the population have taken at least one dose of a vaccine, 16% have been given 2 doses. However, the district with 106 civic bodies, including 12 municipalities, finds it tough to plan any massive vaccination campaign because the vaccines allocated for Malappuram are distributed through 116 health centers. The state seems to be doing very well on the vaccination front, with 42.81% having received the first dose and 17.86% both the doses. In the 45+ age group, 83% have been administered the first dose while 43% have received both the doses. The current predicament of rising cases in the state should be weighed against the unique situation created by the circulation of the Delta variant, which has been leading to reinfections as well as breakthrough infections in fully vaccinated individuals, says a public health professional. It is high time the state paid attention to the disaggregated data of new infections, because the proportion of reinfections and breakthrough infections among new cases will help the state identify pockets where active transmission is on. The false sense of security among vaccinated individuals might keep the Delta transmission chains alive for a long time, as it is now established, by the Centers for Disease Control and Prevention, that vaccinated persons have viral loads similar to that of unvaccinated persons, which helps them transmit the infection easily, a senior public health professional says. The state has the lowest seroprevalence rate in India. According to the Indian Council of Medical Research's 4th round of seroprevalence study in June, only about 44% of the state's 3.5 crore population had developed antibodies to the virus. Since mid-May, the Delta virus variant has been driving up cases, causing a prolonged epidemic. People's behavior in Malappuram has always been a subject of criticism. When shops opened, crowds thronged the stores. Marriages took place and the police turned a blind eye to the numbers attending the wedding celebrations. Traffic jams were common in several of Malappuram's towns during the lockdown. Usually it takes 38 minutes for us to cover 46 kilometers to reach Kozhikode Medical College from Manjeri Medical College. But there were days when it took nearly 1.5 hours on emergency trips during the lockdown, says Pavan AR, an ambulance driver. Rakul Gayatonda, public health expert and professor, Sri Chitra Tirunal Institute for Medical Sciences and Technology, says, "It is ironic that while the government was clamping down on public life and movement, the business community and markets as part of its containment measures, congregations, and celebrations were going on uninterrupted in private spaces, potentially sustaining disease transmission." Pandemic fatigue. But while this is just disease epidemiology that one cannot alter, a team from the National Center for Disease Control has come down heavily on the state for its failure to implement home isolation and care effectively, for poor and inadequate contact tracing and containment measures, and for a low proportion of RT-PCR tests, which it says have led to the current surge in infections. Kerala's testing levels have been consistent throughout the pandemic. Tests were increased when the second wave hit. An average of 1.5 lakh tests were done daily, but a large proportion of them were rapid antigen tests. While officials refused to comment on this, health officials admit that the diligence and thoroughness with which the state used to do contact tracing, isolation and follow-up is no longer possible. The same goes for home care and follow-up too, which has been faltering. With patients coming to hospital at a later stage of the disease, mortality is going up. Earlier, health workers were supported by the local bodies, volunteer groups, police, and teachers. 1.5 years later, we are on our own. We are acutely short-staffed, overworked and tired. The same group is being roped in for all COVID-19 related activities, from testing to vaccination, apart from immunization and vector control, a field worker says. Pandemic fatigue has affected everyone, and communities and health workers need more support and incentives from the government. Districts need to be supported with strategies that have a more local context, says Gayatonda. Mortality reduction is another area where public health experts feel that the state can do more. There were wide fluctuations in the mortality rate, from 0.2% to 1.2%, between April and July 2021, and also between districts. Health Minister Veena George said in the Assembly this week that disease severity seemed to have reduced due to rising vaccination numbers. Even when cases were rising, hospitalization and ICU occupancy seemed to remain stable, she said. The reinfection rate has come down, but breakthrough infections are now being reported, she said. On Thursday, the government announced in the Assembly that it was replacing its test positivity rate, TPR-based containment strategy, which it had been following for the past 6 weeks, with a micro-containment strategy wherein only specific localities, wards in rural areas and streets in urban areas, will be under lockdown, depending on the number of new infections in a locality. The TPR-based strategy had been widely criticized as unscientific and counterproductive because TPR can be easily manipulated. TPR is the proportion of positive cases from the total tests done, and therefore, large-scale testing amongst people who are unlikely to be infected can artificially bring down the TPR. But the government had refused to listen to the criticism. With the lockdown affecting the livelihood and freedom of people, it became important for the local bodies to reduce the TPR so they could maintain their political image and local popularity. A high TPR in a lockdown was projected as being a measure of their inefficiency. Thus, all local bodies were competing with each other to reduce the TPR somehow by herding in everyone to test, rather than testing appropriate groups. This had seriously affected actual disease containment. Clearly, Kerala is facing its toughest challenge yet. If, till now, it was a struggle to save lives, a rising case graph and pandemic fatigue is forcing the government to gear up to the bigger challenge of striking a balance between saving lives and protecting livelihoods. Thank you. Faith. Karma Phala Data. In the Devi Bhagavata Purana, Vyasa further explains about the workings of karma to Janamejaya, and says that none but the omniscient Lord can officiate as a judge in the lives of all mortal beings, as he is the sole Karma Phala Data. It is shown that the prime effect of karma is janma, by which the jiva exhausts past karma, and since karma is not easily exhausted, the jiva is born repeatedly in samsara, pointed out Sri K. Srinivasan in a discourse. Sometimes a single birth or many births would be needed to exhaust even a single karma, for it depends on the type of karma and the corresponding fruits. Also, it is not that karma phala is experienced in accordance to the chronological order in which the karmas are done, and these experiences may pertain to this world or to other lokas also. Some are born rich while some are poor, while some are born with congenital defects, and so on. One may have a sound mind, intellect, and well-functioning sense organs but yet cannot know what karma is responsible for his present state. These disparities are all owing to the jiva's past karma about which only God is aware. Based on all these factors, God decides the kind of birth for every jiva. Even at the logical level, the judge dealing with offense and punishment is bound with a certain amount of freedom and responsibility. He does not allot punishment purely on the basis of the code of laws. He evaluates the crime and the offender from various angles. Is it a first-time offense? What was the motive? Does the person need time for reforming? At the spiritual level, God, as the karma phala for all mortals, meticulously allots the reward and punishment for each one's merits without prejudice in this never-ending cycle of samsara. Thank you. Thank you so much for watching this video as a podcast. Do like, share and comment. Press the subscribe button and hit the bell icon to get new notifications. Thank you. Take care and stay safe. God bless you all. Jai Ma Bharti. To download news and editorials in mp3, follow us on Telegram, Virtual School Official. The link is provided in the description below.